You think you have an ACL injury? What do you do next? Talk to the professionals. And today we'll be doing exactly that. We'll be talking to a knee surgeon and a physiotherapist to find out what to do next. So when someone walks in with a potential ACL injury, where would you actually start?
For me, this is in three parts: history, examination, and imaging. So the history is what the patient tells me about their injury, the circumstances of the injury, how they're felt, and how their knee feels afterwards. It's really important, and I get so much information from that. The second bit is the actual clinical examination. So I would examine the knee, see how swollen it is, how much of an injury there's been, whether there's been injury only to the ACL or to the other ligaments as well. The third part is imaging, X-ray and MRI scan. So I would get an X-ray to check if there's been a fracture, and I would get an MRI scan to specifically look at the soft tissues and see whether there's been an injury to the ACL, the other ligaments, or any of the other structures.
So speaking of imaging, how crucial is it that they get an MRI?
It's very important. It's very good at finding out exactly which structure has been damaged and whether it's only the ACL or whether a shock absorber or a piece of cartilage has been damaged too. It really helps for surgical planning. Every patient gets an MRI scan before an ACL reconstruction.
Can you get away with not having any MRIs or X-rays if you've got an ACL tear?
In short, most people get an MRI. However, if you are unable to have an MRI scan for various reasons, so some people can have pieces of metal inside their body or specific medical equipment inside their body, which prevents them from having an MRI scan, you can not have it, but it's from a surgical planning point of view, if a patient's able to have one, I would quite like to obtain one.
So the long and short of it is, we can't really escape it.
Yeah.
Going to the hospital is inevitable.
I think this is a really good point to raise. I think you should see someone if you've had a big knee injury, because actually you risk making things worse if you just let it rest.
So looking at it from a rehab side of things, how much do MRIs, X-rays, things like that really help?
X-rays not so much with an ACL injury. You're not going to detect an ACL injury on an X-ray. MRIs are helpful. They will help you confirm the extent of the injury, partial tear, full tear, things like that. But that's just part of the assessment. You don't treat a scan, you treat a patient. So a lot of what we work on is from the physical assessment, because you can detect ACL instability on an assessment. You can look at strength, stability, all those things you'll get from the physical. So the MRI is helpful, but it's only part of it.
So I guess from a physio perspective, depending on what the person was doing before, the same tear on two people could be
completely
extremely different.
Yeah. So you can have someone who's got what you think is maybe a full rupture, but really have good stability, good strength, minimal symptoms. So it's not just, oh, someone's got a tear, they need surgery. Particularly, it's like, right, what are their goals? What are they hoping to achieve? What's their baseline? The scan helps with that, but it's not the be all and end all.
What is the plan? Because obviously we know these days it's really difficult to get in for MRIs and X-rays straight away. So say someone can't get in for those straight away, what would your advice be at that point?
In an ideal world, try and get in and see a physio, or at least a healthcare professional who can try and get an idea of what the extent of the injury is, give you advice on how to manage it in the acute phase, where there's going to be the biggest limitations, and at least put a plan in place so that if you are then waiting for an orthopaedic consultation or an MRI scan, you're still doing things proactively to improve your condition. And then regardless of what scans show, you're in a better starting place.
Thank you for watching this video. If you want more information on ACLs, click here.